Did you know that 1 in 3 Americans over the age of 65 will experience a mini stroke? Many without ever realizing it happened? I've seen it time and again in my 30 years as a neurologist. A patient comes in for something minor, a little fatigue, some forgetfulness, maybe a dizzy spell, and then we uncover the truth. They had a mini stroke, no chest pain, no warning, just a brief moment of confusion or weakness that passed so quickly they thought nothing of it. But here's the reality. Those nothing moments can be the final warning before something far more serious. Research shows that 1 in 5 people who have a mini stroke will go on to have a major stroke, most within just 2 days. And that's why I made this video for y'all. Because too often, older adults are told their symptoms are just part of aging, that it's normal to feel a little off, to forget a name, or to get tired more easily. But it's not always age. It might be your brain trying to get your attention. Today, I'm going to walk you through 8 warning signs of a mini stroke that most people miss. And at the end, I'll show you 3 powerful foods that may help protect your brain before a stroke ever happens. If you're over 60, this could be the most important message you hear this year. So please stay with me until the end. Hit the like button if you care about your brain, and subscribe if you want more health tips like this. Because your brain isn't just aging, it's asking for help, and it's time we start listening. Number 1, brief episodes of memory loss and disorientation. Let me start with what I consider the most dangerous, and sadly most ignored, sign of a mini stroke. Sudden short-term memory loss or disorientation that seems to come and go. I've seen this more times than I'd like to admit. A patient's spouse will say, "He seemed fine all day, but then for a few minutes, he didn't know where he was. He kept asking me the same question over and over. And then, just like that, it passed." They shrug it off. Maybe it was stress. Maybe he was tired. So they don't go to the ER. But here's what I need you to understand. That moment wasn't harmless. It was a flare from the brain, a warning shot. We call it transient global amnesia in medical terms. It sounds fancy, but what it means is simple. The part of the brain that controls memory and orientation, especially the hippocampus, wasn't getting enough blood. And when that happens, the brain can't lay down new memories. You forget where you are, what you're doing, or even who someone is, just for a few minutes, and then it fades. And most people think it's over. But the stroke risk has only just begun. What makes this symptom so dangerous is that the person often doesn't even know it happened. They remember everything before and after, but not the event itself. So it's up to loved ones to recognize what's going on. Here's what to look for. Repeating the same question within minutes, as if it's the first time. Not knowing where they are or how they got there. Looking around confused during a normal routine. Not recognizing familiar places or even faces for a few moments. Seeming distant, not there or deeply lost in thought, then suddenly snapping back to normal. I once treated a retired school principal, sharp as a tack, always organized. Her husband said one morning she walked into the kitchen, looked around confused, and asked, "Why are we here?" Then a few minutes later, she was making a coffee like nothing happened. They almost didn't come in. But a scan revealed she'd had a transient ischemic attack. And worse, she had a second full-blown stroke 2 days later. This is why these brief memory episodes should never be brushed aside. They're not normal aging. They're not just tired. They are signs that blood flow to the brain has already been compromised. Studies show that nearly 50% of older adults who experience this kind of short-term memory disruption will suffer a major stroke within 1 year, unless they receive preventative care. So what should you do? If you or someone you love experiences a moment like this, even if it clears up in 5 minutes, seek immediate medical attention. A simple scan can reveal what's going on. And timely treatment, whether it's medication, lifestyle changes, or addressing a heart rhythm issue, can prevent permanent brain damage. Because here's what I want you to remember. Your brain doesn't send false alarms. If something feels off, especially with memory or orientation, don't wait. That moment might be your only chance to stop a life-altering stroke before it happens. Now, let's talk about another symptom that often gets mistaken for stress or medication side effects, but could be the second warning sign your brain sends when it's in danger. Number 2, sudden speech changes. Now let's talk about a symptom that stops families in their tracks, but still far too many dismiss it: sudden changes in speech. Imagine this: you're chatting with your spouse over breakfast. Everything's normal. Then suddenly they slur a word or say something that makes no sense. Maybe they're trying to tell you what's on their mind, but the words just don't come out right. You ask them to repeat it, and they look confused. Or worse, they don't even notice anything strange at all. That moment, that's not just getting older. It could be your brain's second warning, a mini stroke in progress. We call it dysarthria when speech becomes slurred, and aphasia when someone has trouble using or understanding language. Both are signs that the brain's language center, usually in the left hemisphere, isn't getting enough oxygen-rich blood. When blood flow is interrupted, even briefly, the part of the brain that forms and understands words starts to misfire. But here's the danger. These symptoms often go away just as quickly as they came. And because they resolve, people think it's okay. They might even laugh it off. I must have sounded drunk for a second. And that's exactly what some families describe. He sounded like he'd had a few drinks, but he hadn't touched a drop. Or she was saying words, but none of them made sense. What's heartbreaking is that the person going through it often has no idea their speech was impaired. They think they were speaking normally. So once the moment passes, they carry on, and the warning goes ignored. Here are some examples of what to watch for: slurred or mumbled speech, saying the wrong word without realizing it, using made-up words or jumbled sentences, speaking slowly or struggling to find common words, unable to repeat a simple sentence clearly, like, "The sky is blue in Cincinnati." This symptom doesn't always come alone. Sometimes it appears with a drooping face or weakness in an arm. But even when it's the only sign, it's serious. I'll never forget one gentleman who came to see me after his wife noticed he spoke nonsense during dinner for about 30 seconds. It had never happened before. He felt fine afterward. But scans showed he'd experienced a TIA. And more importantly, we caught it in time to prevent a full-blown stroke. The acronym FAST was created for a reason: face drooping, arm weakness, speech difficulties. Time to call emergency services. Speech is one of the fastest and clearest signs that something is wrong in the brain. And time is critical. The sooner we respond, the better chance we have to protect your brain from permanent damage. So please, if you or someone you love suddenly sounds different, like they're slurring, using the wrong words, or speaking gibberish, don't wait to see if it goes away. Treat it like a fire alarm. Your words are one of the most precious ways you connect with the world. When speech changes, the brain is speaking to you in a language of its own, asking for help. Now let's move to another sign that's easy to ignore, especially in older adults, but could be just as dangerous: extreme unexplained fatigue. Number 3, unexplained sudden fatigue. Now let's talk about something nearly every older adult feels, but often ignores: a sudden wave of overwhelming fatigue. I don't mean the kind of tired you feel after gardening or staying up late watching TV. I'm talking about the kind of exhaustion that hits out of nowhere and knocks the wind right out of you. Patients often say, "Doctor, I just felt drained, like my body turned to lead. I couldn't even lift my arms to finish folding the laundry." Or, "I was walking to the kitchen and halfway there it felt like I had walked a mile." Here's the danger. This kind of fatigue can be a sign of a mini stroke. Most people never think of fatigue as a brain issue. They blame it on age, the weather, poor sleep, medications, or just doing too much. And while those can cause tiredness, sudden, profound fatigue, especially if it's out of character, can signal that your brain isn't getting the oxygen it needs. Why does this happen? When blood flow to certain parts of the brain is briefly interrupted, especially areas involved in motor function and alertness, your body enters a kind of energy crisis. Everything slows down. You may feel like you're walking through molasses or trying to move with heavy weights strapped to your limbs. Some describe it as a fog. Others say it feels like gravity just got heavier. But one thing's consistent: rest doesn't help. You sit down, lie down, even take a nap, but the heaviness lingers. That's what makes this symptom different from regular tiredness. True stroke-related fatigue comes on suddenly without clear cause, doesn't improve with rest right away, and affects your whole body, not just one area. Often comes with a gut feeling that something's wrong. And here's something even more alarming. Studies show that in about 40% of elderly patients who later had a full stroke, unexplained fatigue was one of the first warning signs. But because it doesn't hurt, because it doesn't scare you, because it seems like just a tired day, people brush it off. That's the mistake. I remember one woman, 78, very active. She walked every morning, cooked for her grandchildren, even volunteered at her church. Then one afternoon, she called her daughter and said, "I don't know what's wrong. I just feel heavy, like I can't move." No pain, no slurred speech, just fatigue. They waited. The next morning, she had a stroke. We caught it early enough to help her recover, but that fatigue the day before, that was the signal. So what should you do if you or someone you love suddenly feels exhausted beyond reason? With no clear cause, don't wait it out, especially if it's combined with any other sign, dizziness, confusion, slurred speech, or trouble walking. Call for help, because your body is wise. Fatigue isn't just an inconvenience, it's a message. And when it's sudden and deep, it may be your brain crying out, "I'm struggling." When you listen, you give yourself the chance to prevent something much worse. Now let's move on to a more visible, yet still misunderstood warning sign. Sudden numbness or weakness, especially on one side of the body. Number 4, sudden numbness or weakness, especially on one side. Now let's move on to a sign that many people do recognize, but just as many still explain away. Sudden numbness or weakness, and especially on one side of the body. Let me say this clearly. If one side of your face, arm, or leg suddenly goes numb or feels weak, this is not something to ignore. This is one of the most classic warning signs that your brain is in distress. When this happens, it's often because a mini-stroke has briefly interrupted blood flow to one hemisphere of the brain. And because each side of the brain controls the opposite side of the body, the effects usually appear only on one side. Maybe your right arm suddenly feels heavy. Maybe your left leg isn't lifting quite right. Maybe your face looks different in the mirror, like one corner of your mouth has drooped. These are all red flags. But here's the problem. Many people brush these off. They say, "I must have slept funny on my arm. Maybe I pinched a nerve in my back. It's just arthritis acting up." And sure, those things can happen, but they don't come on suddenly, without warning. That's the difference. Stroke-related numbness or weakness appears out of nowhere, often affects the whole arm, leg, or one side of the face, not just a small patch. Doesn't go away with a stretch or change in position. Sometimes clears up in a few hours, but that doesn't mean the danger is over. The temporary nature of this symptom is what makes it so misleading. Many mini-strokes, TIAs, cause symptoms that vanish within 24 hours. And when they do, people assume everything is fine. But I've seen too many cases where someone felt weakness in one arm in the morning, felt better by dinner, and had a full stroke that night. That first sign was their only chance to stop it. One easy test I often recommend: ask the person to smile. If one side of their mouth doesn't rise evenly, that's a major warning. Another test: ask them to raise both arms. If one arm drifts downward or won't lift fully, that's a signal something's wrong in the brain. I'll never forget a patient who came in because her husband noticed she was dragging her left foot. She hadn't bumped it, twisted it, or done anything unusual. She just couldn't lift it the same way she used to, and it happened suddenly. Her TIA had affected the motor area on the right side of her brain. We caught it in time. She recovered fully. But if she had waited even one more day, the outcome might have been very different. So please, if you or someone you love suddenly can't feel, lift, or move one side of the body, don't guess, don't wait, call for help. The brain works fast, and when blood flow is blocked, every minute matters. Next, let's look at a sign that feels very different, but is just as urgent: a sudden, intense headache that comes out of nowhere. Number 5, sudden, intense headache. Let me ask you something personal. Have you ever felt a headache that hit you like lightning, sharp, sudden, and overwhelming? If you have, and especially if you're over 60, I need you to listen carefully because a sudden, severe headache isn't just a nuisance. It could be a sign that your brain is under attack. We're not talking about your usual tension headache or even a migraine you have had before. This is different. Stroke survivors often describe it as the worst headache of my life or like a thunderclap in my skull. It often strikes without warning, without a trigger, and reaches its peak within seconds to minutes. The medical term we sometimes use for this is thunderclap headache. And while it can have various causes, one of the most serious is a mini stroke or a bleeding event in the brain. So why do so many people ignore this? Because we've all had headaches. And as we get older, many just accept them as part of life. Maybe you're dehydrated. Maybe it's the weather. Maybe it's just stress, right? But here's what I tell my patients. If a headache feels different from what you normally experience and it's sudden and intense, don't guess. Get checked, especially if it comes on like a jolt, not gradually. It feels one-sided behind one eye or in an unfamiliar spot. It doesn't respond to your usual pain relievers. It comes with other symptoms like vision changes, nausea, or dizziness. You see, during a mini stroke, if blood flow is restricted or leaking occurs in vessels near pain-sensitive areas of the brain, that pressure builds fast. And the brain, unlike other parts of your body, can't stretch or swell much, so the pain can be intense. But here's the twist. Some people experience this kind of headache, then feel fine an hour later. The pain goes away, and they assume it was nothing serious. That's the most dangerous assumption of all. I recall one patient, 72 years old, who went to bed early with a terrible headache she said came out of nowhere. The next morning, she couldn't move her right arm. That headache? It was the first sign. The good news is, if you act fast, we can often prevent a full-blown stroke. We have medications, imaging, and treatments that can protect your brain if we intervene in time. But once that window closes, often in just a few hours, the damage can become permanent. So if you or someone you love ever says, "This doesn't feel like my usual headache," don't wait. Call emergency services. Because pain is your brain's alarm system, and when it rings like this, it means something's seriously wrong. In a moment, we'll talk about one of the most visible signs of a mini stroke and one of the most ignored, sudden confusion or trouble understanding speech. But first, take a breath. Your awareness, your instincts, and your willingness to act, that's your greatest protection. Number 6, sudden confusion or trouble understanding. Let's take a moment and talk about something truly frightening because it doesn't just affect the body. It affects the part of us that makes us who we are, our mind. I'm talking about sudden confusion, disorientation, or trouble understanding what's going on around you. Now, it's easy to brush this off. After all, we all forget things from time to time. Maybe we blank on someone's name. Maybe we lose track of a conversation. That's just part of getting older, right? Not always. When confusion comes on suddenly, and especially if it's dramatic or unusual, that can be a warning sign of a mini stroke. Here's what it might look like. You're watching a TV show you've seen dozens of times, but suddenly you can't follow the plot. Someone asks you a simple question, and your brain just stalls. You're in your own home, but feel unsure of where you are or even what day it is. These moments aren't ordinary forgetfulness. They're not like the slow changes of dementia. Instead, they come out of nowhere, last for minutes to hours, and often resolve completely, leaving the person feeling back to normal. And that's what makes them so dangerous. Because once that confusion fades, people often think it was just a fluke. They're relieved, and they don't get help. But that moment of confusion may have been your brain's only chance to warn you before a full stroke strikes. Research shows that up to 40% of older adults who experience sudden confusion during a TIA will have a full stroke within a year if no preventive steps are taken. So what's going on in the brain during these episodes? Usually it means blood flow to the temporal lobe or parietal lobe, the areas responsible for understanding language, recognizing surroundings, and storing short-term memory, has been briefly interrupted. That disruption makes it hard to make sense of the world. I once had a patient whose wife noticed something odd. He was sitting at the kitchen table, staring blankly at his cup of coffee. When she asked if he was okay, he said, "What's this again?" and pointed to the spoon. He couldn't remember the word. An hour later, he was back to normal. But she brought him in, and the scan showed he'd had a TO. Her quick action likely saved his life. So if you or someone you love ever seems suddenly off or disoriented, struggles to understand simple conversations, uses the wrong words, or stops mid-sentence and can't finish their thought, treat it as a medical emergency, even if it gets better, and especially if it gets better, because when the mind starts to flicker like a light bulb, that's your brain saying, "I'm not getting what I need." And like any flickering light, if you don't check the wiring, it could go out completely. Next, we'll explore another sign that's easy to miss, but maybe your brain's most direct cry for help: brief memory loss or episodes of complete disorientation. Number 7, sudden vision changes. When was the last time your vision suddenly went blurry for a few seconds? Maybe you thought it was just eye strain or that you needed new glasses. Maybe you even blamed it on aging. But if that change came out of nowhere and then vanished, it might have been something much more serious. In my 3 decades of practice, I've seen many older patients who describe sudden, strange changes in their vision. Some say it felt like a curtain dropped over one eye. Others say their vision split in half, or one side of their world just disappeared. The scariest part? It only lasted a few minutes. And because it went away, they didn't think it mattered. But I want you to hear this. These brief changes in vision can be warning signs of a mini stroke. When blood flow to the part of your brain that processes vision is interrupted, even for a short time, you may experience sudden blurriness, partial blindness, or double vision. These episodes often affect just one eye or one side of your visual field. What makes this symptom tricky is how easy it is to mistake it for something else. Maybe dry eyes, maybe fatigue. But mini-stroke vision problems don't usually come with eye pain. They don't build up slowly, and they almost always disappear before you can process what happened. That's exactly why they're so dangerous. Studies show that people who experience these fleeting vision changes are at significantly higher risk of having a full-blown stroke within days or weeks if they don't receive medical care. I once treated a woman in her 70s who described a strange blackout in her left eye. It was like a shade being pulled down, she said. It lasted maybe 10 minutes. She felt fine afterward, but her daughter insisted she come in. That visit revealed a recent TIA, and we were able to act quickly to protect her from something worse. So if you or someone you love has ever lost vision in one eye, even for a moment, seen double out of nowhere, or felt part of your visual field go dark or blurry, don't ignore it. Don't wait. Get checked. Our eyes don't just show us the world, they sometimes show us the first signs that something's wrong deep inside. Next, we'll talk about a symptom that's often dismissed, but could be your body's cry for help: a sudden wave of overwhelming fatigue. Number 8, sudden, unexplained fatigue. Let me ask you something that many people over 60 have felt, but often overlook. Have you ever been going about your day, feeling fine, and then out of nowhere, it feels like someone pulled the plug on your energy? You're not just tired, you're drained. Even standing feels like a chore. Walking to the kitchen feels like climbing a mountain. And no matter how much you rest, the exhaustion doesn't lift. This kind of sudden, overwhelming fatigue is not normal aging, and it's not something to brush off. It may be one of the most overlooked warning signs of a mini stroke. Many people assume fatigue means they didn't sleep well, or maybe they're coming down with something. But when that tiredness comes out of nowhere and is deep, heavy, and unfamiliar, it can mean the brain isn't getting enough blood. That's what happens during a mini stroke. When circulation is briefly disrupted, especially in areas of the brain that regulate movement and alertness, it can feel like your whole system shuts down. You may feel sluggish, like you're moving through molasses, weak and all over, not just sleepy, unable to concentrate or finish simple tasks. One patient of mine described it perfectly. He said, "It was like someone turned up the gravity. I just couldn't lift myself out of the chair." That's not normal fatigue. That's neurological fatigue. The biggest danger here? Most people wait. They tell themselves, "I just need to lie down," or I'll feel better as after lunch. And maybe they do, for a while. But the fatigue returns, or worse, a full stroke follows within days. Research shows that sudden, unexplained fatigue, especially when paired with other minor symptoms like dizziness, confusion, or vision changes, can be an early red flag for serious brain trouble. One study even found that nearly 40% of older adults who had a stroke reported feeling unusually tired in the days or hours before. So if you or someone close to you suddenly seems unusually tired, slow, or disconnected, pay attention, especially if they say things like, "I just don't feel like myself today. I can't explain it, but something feels off. It's like my body gave up on me." Don't chalk it up to age. Listen to the fatigue. It may be your brain's quiet way of saying, "Help me." Coming up next, we'll talk about one of the clearest, loudest signs that your brain may be in trouble: changes in speech. We've just explored 8 silent but serious warning signs of a mini stroke. From unexplained fatigue and sudden confusion, to vision loss, balance issues, and brief memory lapses, each of these symptoms may come and go quickly, and that's exactly why they're so dangerous. As someone who's practiced medicine for over 30 years, I can tell you from the heart. Your body always whispers before it screams. We just need to learn how to listen. After 60, what once seemed harmless, like dizziness, slurred words, or tiredness, could be your brain's last attempt to say, "Please help me," before it's too late. But here's the hopeful truth. If you recognize the signs early and take simple, consistent steps, you can stop a major stroke before it ever happens. You don't need pills. You don't need surgery. You just need to stay hydrated, get regular rest, walk gently every day, and most importantly, pay attention when something feels off. If you found this video helpful, let us know in the comments by typing the number 1 below. If this is the first time you've heard about these warning signs, type 0 so we can bring you even more life-saving content like this. And if you're someone who takes walks every day and you're over 60, you need to see what we're sharing next. In our next video, I'll reveal one common walking habit that seems harmless but can quietly increase your stroke risk overnight. It's something I see too many people do, and they have no idea what it's doing to their brain and heart. Click here to watch now. Over 60, this walking habit raises stroke risk overnight. Because when you understand your body, care for your mind, and walk with intention, aging doesn't have to be about slowing down. It can be about living deeper, stronger, and more purposefully, one day at a time.